We're going to move to another one, Lorlatinib. You've heard about this drug again when the ALK presentation was given earlier today. It's a third-generation ALK and ROS1 inhibitor. On a phase 2 trial in ROS1 positive non-small cell lung cancer, 57% of patients had baseline asymptomatic brain metastasis. The overall response rate was 41%, but if you look at the subset of TKI naive, so untreated patients with molecular, the response rate was 62%, 10% was complete response. The response rate in crizotinib treated patients a little bit lower at 35%. Progression-free survival 21 months, which is longer than what we are used to seeing. And there was an intracranial response rate of 64%. So very active drug, especially CNS. Side effects, the prior speaker talked about edema, peripheral neuropathy, some cognitive effects, and an unusual side effect of elevation of cholesterol and triglycerides that sometimes leads to therapy need. So the clinical activity of lorlatinib is similar to other available TKIs. It has an excellent CNS control with a response rate in that trial of 64%, has efficacy against crizotinib-treated patients, except if they have the G2032R mutation. So remember, that's a key factor. So it's an attractive second-line option, and it's not FDA approved at this time. Repotrectinib, if you read the literature from a few months or years ago, the name is TPX005. It's a second-generation ROS1, ALK, and TRK inhibitor. It inhibits ROS1 with a greater than 90-fold potency compared to crizotinib, so very potent. Common side effects, again, you've heard this from the previous presentation: dizziness, taste disturbances, some numbness and tingling, and constipation. On the TKI naive group, in this case, 22 patients, you can see that the response rate was in the 90% range, 91%, with a duration of response that almost 2 years. And you can see the side effect profile on the right side, similar to what we just discussed. There was a cohort of patients, I'm going to get your attention to the third line, ROS1 positive, TKI pretreated, so they were exposed to crizotinib or another TKI, but no exposure to platinum-based chemotherapy. Response rate 67%. That led to the FDA 2 months ago granting a breakthrough therapy designation to Repotrectinib for the treatment for patients with ROS1 positive metastatic non-small cell lung cancer, previously treated with 1 line of ROS1 TKI, but not received platinum-based therapy. So basically, second line.